Post-pulmonary embolism syndrome is a syndrome of heterogeneous group of disorders which should be diagnosed 6 months after treatment of pulmonary embolism with anticoagulation. So we can't diagnose it before 6 months because symptoms may still be ongoing. So patients should receive at least 6 months of anticoagulation for pulmonary embolism. Although we should certainly ask about symptoms such as exercise intolerance, shortness of breath, decreased quality of life at every visit that we have the patient. My name is Stanislav Henkin. I'm a cardiologist and vascular medicine specialist at Mayo Clinic. And today I'm going to talk to you about post-pulmonary embolism syndrome, diagnostic dilemma, and challenging management, a review that will be appearing in Mayo Clinic Proceedings in the December issue. The reason that we wanted to review this topic is because it has come up so often in clinical practice. I see patients with pulmonary embolism 3, 6, a year down the line after their pulmonary embolism event, and they report shortness of breath, exercise intolerance, decreased quality of life. So me and my colleagues really wanted to delve into this and discuss how we can improve care of patients with post-pulmonary embolism syndrome. The way that I like to think about it is we need to develop a systematic approach of patients with symptoms. So the important questions to ask in your visit is, are you short of breath? How much can you do now compared to what you were able to do before your pulmonary embolism syndrome? How do you feel in general? Are you depressed? Are you not able to do as much as you were before? Really compare that symptoms now to before pulmonary embolism, because that comparison is really, really important. And after you suspect that something may be going on, i.e. post-PE syndrome, it is then really important to develop a systematic approach to get the right diagnosis. So the possible diagnoses that we may have really depend on what we find. Is there evidence of chronic thrombus, or is there no evidence of chronic thrombus? When we think about chronic thrombus that is present, we then have to think about chronic thromboembolic pulmonary hypertension, which is defined as pulmonary hypertension at rest, or chronic thromboembolic pulmonary disease, where there is no resting pulmonary hypertension, but patients may develop pulmonary hypertension with exercise. If there is no chronic thrombus present, then we need to think about things like RV impairment or functional impairment due to deconditioning. Really, other important things to consider is coronary ischemia, because the patients that have had pulmonary embolism may have risk factors for coronary ischemia as well, and pulmonary embolism may really unmask these symptoms because of exercise intolerance and deconditioning. So as shown in figure 1, this really tells you the first steps to consider when thinking about post-PE syndrome, which diagnosis to consider. First, it's important to get a transthoracic echocardiogram and a VQ scan. So the VQ scan will show you, is there evidence of perfusion-ventilation mismatch, i.e. is there chronic thrombus present? The transthoracic echocardiogram will show you evidence of pulmonary hypertension at rest, evidence of right ventricular enlargement or dysfunction, or even new diagnosis of LV dysfunction if there is, for example, coronary ischemia. But this is really the first steps to consider. The next steps will then depend on the results of this testing. If the transthoracic echocardiogram shows pulmonary hypertension, a VQ scan is abnormal, then this is really consistent with diagnosis of CTEPH. If VQ scan is abnormal, but transthoracic echocardiogram shows that there is no evidence of pulmonary hypertension, then it's really important to consider exercise right heart catheterization for evidence of exercise-induced pulmonary hypertension. And lastly, if both are abnormal, then you need to consider other possibilities. And this is when invasive or non-invasive cardiopulmonary exercise tests may be really helpful, because this may tell you evidence of deconditioning, RV dysfunction, or other comorbidity. So then when you've made the correct diagnosis, as figure 2 shows, treatment really depends on the correct diagnosis. If there is evidence of chronic thromboembolic pulmonary hypertension, then considerations include pulmonary endarterectomy, or balloon pulmonary angioplasty, or even medical therapy if a patient is not a candidate for either of these two procedures. If a patient undergoes pulmonary endarterectomy, but there is still presence of persistent hypertension, then one may consider ongoing medical therapy or even consideration of transplant. Other diagnoses, such as chronic thromboembolic pulmonary disease, First, it's important to consider long-term intervention. These patients should be considered for pulmonary rehabilitation, although insurance coverage may be an issue, and you should be discussing at least home exercise with these patients. If there is persistent exercise-induced pulmonary hypertension, they should certainly be seen by a specialist for consideration of balloon pulmonary angioplasty or maybe even pulmonary endarterectomy. Finally, if there is evidence of other cause of chronic symptoms such as deconditioning or RV dysfunction, really first, these patients should be considered for long-term anticoagulation, but as previously discussed, you should certainly discuss exercise therapy with them. So this article reviews systematic approach to management of patients with exercise, with post-pulmonary embolism dyspnea, different differential diagnoses, how to go about each diagnosis. But I think the most important takeaway for this is that it is important to refer these patients early to a cardiovascular medicine specialist. Please consider Mayo Clinic as a referral center for these patients, and I look forward to hearing your thoughts about this article. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.